session is going to be recorded. So I will go back to share now. Okay, so we are going to go ahead and get started here.
Okay. And just so you know, if you have any questions, you will receive a Google form, and you can ask any questions there. So first, we're going to talk about the 3 W's, then we're going to go over a training video, and then hand washing. We'll have the Health Task Force Subcommittee information and the Return to Learn. Okay, next slide. So for the 3 W's, things you want to try to do to try to reduce the risk of COVID-19. So wear a mask. If everyone wears a mask, it helps protect everybody. Wash your hands. Make sure you wash your hands for at least 20 seconds. And watch your distance. Try to maintain that 6-foot distance at all times. Okay. So in the video that you're going to see, it's going to cover the virus transmission, the symptoms of COVID-19, what to do if you suspect that you have the virus, and when you can return to work. And also, we will cover how to protect yourselves and others.
As you can see here from this slide, there's several different terms out there that you've probably heard before, might be familiar with, talking about COVID-19 or coronavirus, whatever you're familiar with hearing with it. But according to the World Health Organization, coronaviruses, plural, are actually a large family of viruses that cause illnesses ranging all over the place, from the common cold to some things that are much more severe than that. And you've probably heard of this year, referred to as the novel coronavirus, because it's novel, it's new, we haven't really seen it before, and the virus itself has been named the Severe Acute Respiratory Syndrome Coronavirus 2, which is why you sometimes hear SARS-CoV-2, and the disease has been called coronavirus disease of 2019, which is why that's often shortened to COVID-19. So we've got a situation similar to what you've probably seen with AIDS or HIV, where HIV is the virus that causes the disease AIDS. It's a similar thing that we're dealing with here. SARS-CoV-2 is just the name of the virus. COVID-19 or coronavirus disease is the disease. Oftentimes these things are used interchangeably, and we all typically kind of know what we're talking about. But I just want to make sure that you are familiar with the classifications and terminology with it. And essentially, as far as the virus transmission routes go, it's believed to spread primarily from person to person through respiratory droplets in the air. You might remember back when people were a lot more concerned about surfaces. You'd hear stories about the UPS man dropping off a package and people leaving it to sit in their yard for a week before they wanted to touch it, or maybe kicking it into their garage so they didn't have to touch it. And we've moved off of that a little bit here. I don't want to move completely off it, because as you can see here, there's still that fear that we might be able to also get it by touching a surface or object that has the virus on it, and then by touching your nose or mouth or face. And so we certainly want to be taking the cleaning and disinfecting of surfaces seriously, but the primary route is believed to be spread mainly from person to person through these respiratory droplets, which is why you've seen the guidance come out the way that it has, where they're saying, stay away from people, keep that 6 feet of distance, because you're much more likely to get it if you're in close contact with someone who's positive. And so that 6-foot cushion that we've been hearing about, is there anything necessarily magical in 6 feet exactly? Is it possible someone could sneeze and send those droplets a whole lot further than 6 feet? Yeah, of course. But, in the typical respirating or breathing here, you're going to be much safer outside of that 6-foot range, which is why that's kind of emerged as the standard there. And also, we need to point out the fact that there's no vaccine currently available for COVID-19. So the best way to prevent the illness, of course, is to avoid being exposed to the virus altogether. As far as symptoms go, this is a tough area because the symptom list is pretty exhaustive at this point. It's a pretty comprehensive list. We started out with a fewer than what you can see here, but as time has gone on, more and more has gotten added to the list. nausea and vomiting, diarrhea, kind of more late arrivals with it. But there's a whole lot of stuff on here. The stuff at the top of the list, the fever, the cough, shortness of breath, those are typically the most common symptoms that have been emerging with this. At the bottom of the list there with the nausea and vomiting and diarrhea, those are much more rare, but could potentially be associated with the virus as well here. So the symptoms can range from mild to severe, and of course there's a whole lot of different ones, but there are a couple things that we really want to be paying attention for, looking out for. Things like trouble breathing, persistent pain or pressure in the chest, new confusion, inability to stay awake or wake up, bluish lips or face. All of these things could potentially be signs that someone is infected with the virus, and of course should seek immediate medical care for that reason. And I would argue, regardless of the cause, if you're having any of those symptoms, trouble breathing, chest pain, all that fun stuff, regardless of what's causing it, whether it's the coronavirus or not, that's something you certainly should be getting immediate medical attention for. And it's important for us to point out how these symptoms can manifest themselves. And this, in a nutshell, is why it's such a difficult thing for people to manage and for some people to take seriously and things of that nature. The symptoms can take between 2 and 14 days to develop. So you may very well have someone who's positive for the virus that's running around feeling great. He's felt great for the last 2 weeks, all this time being positive for the virus. And to make matters even a little bit worse, it's also possible for someone to be completely asymptomatic altogether, and they never get any of those symptoms, not even at day 14. They're feeling great the whole time. Doesn't necessarily mean that they aren't a carrier, that they aren't infected still. And that, in a nutshell, is why you're seeing so much of the guidance that we've been seeing of, treat everyone as if they're infected, right? Keep your distance, wearing the face coverings and all that fun stuff. So it's just important for us to understand how these symptoms can manifest themselves. We also need to discuss the fact that some people are at an increased risk when it comes to COVID-19. There's just been a pretty high correlation between age and the severity of the disease here. So unfortunately, the older we get, the more susceptible we are to having a pretty negative health outcome if we were to become infected with COVID-19. So children, by and large, as an entire group here, actually fare pretty well. It's probably not, the worst thing in the world for them to get. They're, not unlike the common cold or something like that. But the older we get, the more serious that condition can be. So there is a correlation there. In addition to just being a correlation with age, there's also a correlation with underlying health conditions and some pretty negative health outcomes as well. So if someone were to have cancer, chronic kidney disease, COPD, obesity, an immunocompromised state from an organ transplant, serious heart conditions, sickle cell disease, or type 2 diabetes, they certainly want to be very careful in avoiding this particular virus, because there already have been some pretty, documented negative correlations with this sort of thing. So I know we're pretty much inundated with information on COVID-19 these days, and it feels like there's conflicting reports. It's hard to really know which numbers to kind of take seriously, and fatality rates and all that. But I think most sources still do agree, the age is a pretty strong indicator, as well as some of these underlying health conditions. Now, some of them are not quite as clear. Again, this is a relatively new phenomenon here. So these conditions listed on this screen here, they might increase the risk of a pretty negative health outcome, but it's not necessarily that we have any conclusive data. It just seems like it might just kind of work that way, right? We're looking at things like asthma, smoking, pulmonary fibrosis, things that are affecting the lungs. This is a respiratory disease, so it would stand to reason that, you might be a little bit worse off if you have one of these conditions to begin with. But again, the jury's still out, so to speak. We haven't really seen it play out quite the whole way. And you probably noticed the immunocompromised state also made it onto this screen. We had it on the last one when it was referring just to somebody who had an organ transplant. This is basically now the all-encompassing immunocompromised state. So maybe someone who is HIV positive or is on steroids that are suppressing the immune system, things of that nature could play into it as well. So what should you do if you know or you suspect that you might be positive for COVID-19? Well, Stay home if you're symptomatic, of course. That's kind of been the guidance from the start here, is to try not to expose other people to it. But if this is something that develops while you're already at the office, where you're in your workplace, and you start to have those symptoms, well, typically, or what should be happening according to the standard, is you should be given a disposable face covering to wear until you can leave the site, and kind of kept in isolation, or kept at physical distance from others until you can safely leave the site. And then at that point, they're really pushing that people work from home as much as possible, because in some cases, it's just going to take some time before you can actually get back to work according to this standard here. So looking at getting back to work, once you've established that you've gone home because you've had some sort of symptom, well, now how can you come back? And there's two different methods that you can get back into the workplace. One is just a symptom-based method. Maybe you've got a few symptoms of it, but you're feeling pretty good. You don't feel like you necessarily need to go seek medical attention, so you're not going to go get tested or anything. In that case, you actually have to wait at least 10 days since the symptoms first started before you can come back to work. You also can't have any new symptoms that appear during that time, or else it's going to reset the clock. And as part of those 10 days, prior to coming back, you still have to have at least 3 days where you have no respiratory symptoms or fever without using any type of cold or flu medication, or some sort of medication that's going to reduce or cover up your fever that you have, the symptoms of that. So going to take some time on the symptom-based side. The test-based side will get you back to work a little bit more quickly. What it's saying here, though, is you have to get not one, but actually 2 different negative tests that are collected at least 24 hours apart. So you've probably seen guidance. We've gotten a lot of questions on this already. Well, the VDH says this, or the CDC says this, and that's all well and good, and hopefully that will maybe at some point affect what we're seeing on the Department of Labor and Industry standard. But as we said before, the Department of Labor and Industry is saying, hey, you've got to adhere to what we're saying. You've got to kind of take it to the most stringent standard, between whatever you're comparing here. And so far, what they're saying is you've got to actually take 2 different tests. They've got to be at least 24 hours apart. So you can't have someone that says, man, I'm not feeling good, I'm going to go get tested. Oh, great, it's negative. I'm just going to go ahead and run that back and get another test right now just so I can knock out my 2 and go right back to work. It doesn't work that way. You've actually got to wait at least a full day before getting that next test. And even still, you still can't have any respiratory symptoms or fever without the aid of fever-reducing medication. And the difference here is they've removed that timing requirement. There's no constraint of for at least 3 days like we saw in the previous symptom-based method. But again, that's going to be part of the test-based method. You got to be feeling no respiratory symptoms or fever while you're not taking any cold or flu medication. You also have to have those 2 negative tests taken at least 24 hours apart before you can return back to your workplace. And some of the general guidance out there on protecting ourselves is going to sound pretty familiar to us at this point. So things like washing your hands, avoiding close contact, covering our nose and mouth, some etiquette stuff like covering coughs and sneezes, cleaning, disinfecting, monitoring your health, all going to be some of the common sense things that we've been kind of looking at since day one of this, but we'll delve into these a little bit more deeply here in these coming slides. So as far as washing your hands goes, we're talking about washing your hands with soap and water for at least 20 seconds, using hand sanitizer that has at least 60% alcohol if soap and water is not readily available, and then still avoiding touching our face if we've got unwashed hands as well. And hopefully it's kind of coming into focus why you're hearing all this about the 6 feet. Again, this is believed to be mainly spread through those respiratory droplets in the air. So if we can keep ourselves away from that range where people are breathing, we're going to keep ourselves away from those respiratory droplets. So maintaining 6 feet of separation from others at all times as much as possible. And in addition to that, because it's not always possible to keep that 6 feet of distance, you might be walking through a doorway or in a hall that's constricted, whatever. When in public, the guidance is going to be to wear a cloth face covering or some other type of face covering over your nose and mouth while you're out in public. And again, this isn't just to protect yourself, but again, to protect everybody else around you, because some people are asymptomatic. You could potentially be a carrier and not even know about it, or you might have been infected a few days ago and the symptoms haven't shown up. So keeping the 6 feet of distance, covering our faces as much as possible. Also covering your cough or sneeze. You might be working in one of those office environments where you are continually at least 6 feet away from the next possible person. Maybe you aren't required to wear a face covering. Still want to cover your mouth when you're sneezing or coughing, because obviously you're going to be sending those droplets through the air otherwise. Also, just don't want to touch your face in general, any of the orifices on your face. Theoretically, someone could sneeze on your hand and you're not going to have a problem with it unless you touch your face with it. You've got to give it a way to get into your system, into your body. So someone sneezes on you, go ahead and wash those hands, get out of the habit of touching your face with it and introducing the virus to your system that way. We're going to get into the cleaning and disinfecting here in a coming slide, so we'll just leave it at that. We want to be cleaning and disinfecting frequently touched objects and surfaces. So again, we're not touching them and then touching our face and contracting a virus that way. And then, of course, stay home if you're sick. There's a big, heavy emphasis being put on self-monitoring because, again, we don't know what everybody's doing in their personal lives. When you were grocery shopping last and someone sneezed on you, or if one of your family members picked something up and you think you've been exposed to it. So we really need to be paying a lot of attention to our own symptoms, our own, who we've been around, and really try to self-monitor and stay home if we're not feeling well. Of course, except to get medical care, as it says here. So as we mentioned before, cleaning and disinfecting, we'll talk a little bit about that. When you're getting into the cleaning, if possible, you actually want to wait 24 hours if you're going to be cleaning an area specifically where someone was known or suspected to be positive for the virus was hanging out. Maybe you've got kind of an isolation room where you're putting somebody who's having symptoms before they can be transported home. If you don't need that room right away, you're actually better off from a safety perspective to wait 24 hours if possible. And the reason being, again, primarily this is an airborne through the water droplets type virus. If you let that place kind of air out for a day, we're not quite as concerned with what's going to be on those surfaces. So it's going to make it a little bit of a safer environment. But of course, that's not always going to be a possibility. So as far as cleaning and disinfecting goes, you always want to use an EPA approved product. You can find an EPA registration number on the product. You can check to see if it's on the EPA's list of approved disinfectants. They're aware of the pandemic as well, so they've been good about posting a list on their website, so you can find that there. Bleach is an approved product. If you're using it on a 10-to-1 ratio, 10 parts water to 1 part bleach, that is an adequate disinfectant. Alcohol solutions can be used as well, as long as they have at least 70% alcohol in them. But as we said before, nothing in the standard is set to negate some of the other standards that we already have in place. Say, for example, chemical safety that's laid out in the hazard communication standard, things that we've been kind of paying attention to from an OSHA or a VOSH standpoint to begin with. All of that still applies here. So you've got to be reading, following the product directions. Chemical safety is going to be important with this. You got to have the safety data sheets available. Obviously, reading the labels before we're using the products and following the labels, doing exactly what they tell us to do. Now, you may have noticed I've got cleaning and disinfecting as the title of the slide, and some people think of these things just kind of interchangeably, that it's a semantics thing and they both mean the same thing, but there actually is a difference between these two terms. Cleaning basically just means using soap and water to kind of reduce the germs and dirt and impurities, allowing you to get down to the surface. And the disinfecting portion of it, that's the portion that's going to actually kill the germs on the surfaces. So in some cases, you may need to pre-clean something or clean an object first before you can get down and get your disinfectant involved and disinfect the surface afterwards. As we said before, with reading and following the directions, follow the contact times. Depending on what solution you're using, it may need to sit on a surface for a certain amount of time before you wipe it off. So make sure you're paying attention to the contact time. And then wear your PPE. Again, this goes hand in hand with what we talked about, not negating the hazard communication standpoint. we got to be thinking about that personal protective equipment, not just to protect ourselves from the virus that could potentially be around us, but also to protect ourselves from the chemicals as well. So wear the PPE that's recommended for the product that you're using, and still wash your hands after removing gloves, just in case there is a little tear or something that gets in a glove and you might get some chemicals on your hands anyways. Still want to remove those gloves and wash your hands afterwards. And any special cleaning protocol that we're putting into place strictly because of COVID-19, we actually don't need to apply those standards if we're able to keep an area unoccupied for 7 days. So much like we saw in our first bullet point here, if you can wait 24 hours, you're going to be kind of doing yourself a favor, because it's airing out a little bit. We're not quite as concerned about the potency of these surfaces. If something's been sitting vacant for 7 days now, we're not really as concerned about the virus at this point. You can basically, you can just clean it according to your normal cleaning protocols. You don't have to take any special COVID-related steps at this point.
Can you hear me? All right, so I'm just going to go through some of the most important information that was just discussed. So remember that COVID-19 is mainly spread from person to person through respiratory droplets and by touching contaminated surfaces. There's a lot of symptoms, but shortness of breath, cough, sore throat, headache, fever, fatigue, those are some of the symptoms. They're still learning more, so this list is continuously being updated, and more things are added as they learn more about COVID-19. So when you suspect that you have it, you need to stay at home. Do not come to work. Call your supervisor immediately and discuss the teleworking or what you need to do for the next step, whether you need to go get tested or what. And that would be a CDC phone call, a Virginia Department of Health phone call, and you would talk to your administrator about that. So you need to have three things. Three things need to be true. At least 10 days have passed since the first symptoms appeared. No new symptoms are appearing. And you have to be fever-free for at least 3 days. Two tests of negative COVID tests 24 hours apart.
So let me Nurse Abel, let me interrupt. So the division does not require two tests.
Okay.
There is only one test required. I walked away to ask Ms. Hargrove.
Okay.
Went through. So we do not require two tests. So one negative test would allow a return.
Okay, good. And then also the CDC has said that 24 hours is acceptable, but we are going with the 3 days at Greensville County Public Schools.
Yes.
Correct. Okay.
Are you ready for the next section?
I am.
All right.
Thank you.
Mm-hmm.
You've heard me saying kind of face coverings the whole time. A lot of people are saying masks. We use that pretty interchangeably because it just makes a lot of sense. But technically, there is a difference between the two. A mask is actually a filtering respirator, like an N95, whereas a face covering is going to be like the little cotton, little cotton mask that you're putting on. It's not really doing any filtering. It's just acting as a barrier between you and the elements. That's going to be a face covering. So with face coverings, it's got to fit snugly but comfortably against the side of the face. Pretty straightforward there, right? If it's not fitting snug, it's not really creating a great barrier for us. But if it's not comfortable, you're probably not going to wear it for very long. So make sure that it's snug but comfortable. You want to secure with ties behind the ears or behind the head. It should be breathable. Again, if you're not able to breathe in this thing, it's not going to last very long. These things should also be laundered regularly. Again, we're wearing these things pretty often at this point. We want to make sure that we're washing them. You're getting them clean, and of course, replace them if they're damaged. They're going to wear out over time, especially if we're washing these things regularly. So what should you do as far as taking on and off a mask, how to don and doff it here? Make sure that your hands are clean in both cases. Wash your hands beforehand. Secure those straps, again, behind the ears or around the head. And even before taking it off, recommendation here is that you're washing your hands and still only touching those straps as much as possible. And then a couple other do's and don'ts dealing with wearing the face covering here. Of course, you want to wear it to cover your nose and mouth, like we've been talking about throughout this webinar here. Don't let it just hang around your neck or below the nose, or loose off your chin, or we got that nice picture of someone wearing it on the top of their head as well. I like that they used a pretty angry looking model for this. I think it's kind of capturing the attitudes of most of us these days here. Might feel a little bit unpleasant, but this is where we're at, right? So there you have it. A couple of the do's and don'ts for the face covering, and getting a little bit more technical.
Okay, so if you are, or when you are wearing a face covering, make sure that you wash your hands before putting it on and wash your hands again when you take it off. So now we are going to discuss gloves, putting on gloves. So we'll have a slide come up on that. Yeah, okay. So when you're donning on and doffing gloves, you need to grasp the outside of one glove at the wrist and do not touch your bare skin. You peel the glove away from your body by pulling it inside out. Hold the glove you just removed in your gloved hand. Pull off the second glove by putting your fingers inside the glove at the top of your wrist. Turn the glove inside out while pulling it away from your body, leaving the first glove inside the second. Dispose of the gloves safely, do not reuse them, and wash your hands for 20 seconds after removing gloves. Okay, so I'm not going to show the next slide yet. So it's a question. We're having a game. A prize can be won. Whoever can put the answer in the chat box first is the winner. So the question is, what are the 3 W's to reduce the risk of COVID-19? So please enter your answer in the chat. And I can't see the chat, Dr. Farquharson, so you'll have to, okay, let's see. Can you see? You can see who it was. Okay, so we have who answered it first. So congratulations, you will be getting a email. Is that right? Isn't that what we discussed? An email? You're muted. Are you trying to say anything?
Yes, we have a Pizza Hut gift card, and we will email our winner. Once I can see the chat, we will email our winner, but whoever it is, congratulations.
Okay. So now we're going to be watching a video on washing your hands. It's from the CDC. When washing your hands, make sure you wash between your fingers, the backs of your hands, and at your wrist. If you do not have soap and water available, you can use hand sanitizer with at least 60% alcohol. Do not use hand sanitizer before you eat. You must wash your hands before you eat and whenever you are planning to touch your face. So I believe the next thing on the list is the Return to Learn plan.
Mm-hmm. And let me get back to all right, let me just move this over. All right, so what I want to share first is that we did have a Return to Learn task force subcommittee for health, and Nurse Sable was the contact for that committee. We had several others, and that document is on the GCPS website, but we had several others who contributed to the body of knowledge that we needed in order to ensure that we were meeting CDC guidelines for students, staff, for visitors. So that team met numerous times to answer questions, to discuss, so that we could actually put that information together and put it into the Return to Learn plan. So we'd have a document to publish for the community, and also a document that had to be shared with the Virginia Department of Education. And we did get the green light for the plan. So we were excited about that and grateful for all of those who supported those efforts. So we are following CDC and the Virginia Health Department guidelines and the phase guidance for the Virginia Department of Education. I am not going to read every bullet to you so you can wipe the sweat from your brow, because like I said, this document is accessible on the website, and a lot of this, the video did walk through. We just want you to know that we do have in writing for the general public, for our staff, for our families, the guidance that and the requirements that are in place for the division. So we are asking social distancing, even in the buildings. We are asking that we maintain that social distancing, that we, as much as we want to hug because we haven't seen you in so long, we want to shake your hand and give you a high five. We're asking you not to do that. You made those really great brownies and you brought them to share with everyone. Please don't share any brownies for right now. We just want to work to keep everyone as safe as possible. And you can read through the rest of the bullets and see some of the things that are listed there. So we will have screenings, and everyone this morning should have completed the invite for the screening. So that is the self-assessment. You should have had a temperature check this morning. The hot number is 100.4. That's the hot number. And if you are 100.4 or higher, we want to make sure that that you go home so that you can get well and that everyone else remains safe. So the screening that you do in the morning is just your affirmation that you are not experiencing any of the symptoms that we outlined today, or any of the symptoms, the symptoms that are listed in the Return to Learn plan. So if you're not sure, you can always go to that document. Again, and there are going to be some things that I repeat over and over again because I just want them to really hit home. We are promoting social distancing and the close sharing of space and the wearing of face covers and wiping down in your space, your high touch areas in your space, and Service Solutions will ensure that those general areas that they are wiped home. And if you are sick, please stay home. So this is just some cleaning information and service solutions, and the things that will be cleaned. Those high touch point areas and workspaces will be cleaned more frequently than usual. You will, if you are in your building and you realize there's no soap or no sanitizer, please reach out to your administration so that they can reach out to us. We want to make sure that everyone stays well stocked with the with what you need to keep everyone safe. We do have electronic static sprayers that will disinfect and foggers that will disinfect contaminated areas, and listed below is the process that we will follow. And here we are to our next question.
Question 2, COVID-19 is believed to be spread mainly from person to person through respiratory. So we got a winner there on the Pizza Hut gift card. That was fast.
Well, great job. Thank you so much. All right, let's go on. And because of your patience, you actually get 10 minutes of your life back today, because you just worked with us through our first session. So thank you. Yes. So we are asking for everyone, even if you've done it already. So we know that starting at 9:18, that's where we will look for attendance. So please enter your first and last name in the chat. Again, you will receive a Google form via email to complete. You can enter your questions in that Google form, and we will send out the name of our prize winners today via email. We want to thank you all so much for joining us, and have a great day. Stay safe and wear your mask.
And keep your distance.
And keep your distance, yes.
Thank you. Thank you very much.
Bye, everyone.
Bye-bye.